Hi, I'm Alexia Vo, and this is my video response to the 3 questions regarding alternate medication. So the first question is, what is your opinion on today's healthcare system? While I think that the healthcare system is extremely broken, I feel that it is really expensive for people to be able to go to a hospital, or I've even heard of people who say, when I'm in help, don't call 911 for an ambulance, because it costs a lot of money to travel in an ambulance to the hospital. And I just think it's a really difficult decision for a lot of people who need the help, and they can't afford it, so they have to turn it down, and so therefore they're unable to really get the help that they really need and deserve. So like, for example, people with diabetes who have to constantly be paying for their insulin, I know that is pretty expensive already, or people who might even need surgeries or a medication prescription, like it's just all expensive. And even after insurance, it might still be costly for some people, but even then, I think that not many people can afford insurance either. I know that my family couldn't for a really long time, and so that makes it really difficult, and we try as best as we can to avoid the hospitals and getting help because of that reason, which is really awful, and no one really deserves that, especially when they are in desperate need of it. The second question, rising healthcare costs are out of control. What can be done about that? Well, a few of the articles that were provided we're talking about alternate medication. Alternate medicine is mainly purposely for balancing out your body, and it's a way of helping it like reach peace in my mind. So for example, like people who do acupuncture or like meditation, that would be a way of performing alternate medicine, and it's a much more natural approach, I would say. I think that can help a lot of more people not have to afford the expensive healthcare. If they can find an alternate way, that would be nice for them. But it's just a bit of a challenge as well, because just because something is natural doesn't mean that it's always safe, and it's best that they do their research first before moving forward with something like alternate medicine. I think another way that we can reduce healthcare costs is to get government funding. And that might sound like an obvious statement, but I feel that the government funds a lot of different programs that may not be necessary to fund, such as like the military or the police force. Although it's understandable why they're being funded, I don't think it's as important as healthcare, especially in current times with the pandemic and how much more the hospital needs right now, and how much more the citizens need help from the government to get better. Furthermore, I think it's just to prove that the government can really take a big role in healthcare costs, because in the UK, for example, they have free healthcare, and I think if they can do it, then our government definitely can do the same as well. The last question, what is your opinion on the quality of healthcare people receive? What about the quality of doctors that care for their patients? I think it really depends on the person and personal experiences, but personally for me, I haven't really had the most amazing experiences in the healthcare system. Just like I mentioned before, it's mainly due to a cost reason. But I think that there are long waiting rooms for people, especially considering COVID times. There's not even like enough beds for people to be separated. And I just remember that being a big statement at the peak of COVID. And I think that in light of the pandemic, it has been exposed that there are quite a few people who are healthcare workers who don't really care about the health of others. And so that makes it a little worrying for me, because I don't want to be in the hands of someone who doesn't really care about my own health, especially if they don't take the pandemic seriously. So I think that is really challenging and should not be the case. But that is it. Thank you.